Hi, my name is Evelina Wallace, and my career goal is to become a licensed professional counselor. And so for my career presentation, I chose to interview a friend of mine who happens to be an LPC. Her name is Terry, and she works for an organization called Samaritan Mental Health Family Center, and she has been working there for about a year. She says the working environment there is very structured and there's not a lot of flexibility. She works Monday through Friday from 8 to 5, and she has to have an hour lunch from 12 to 1. She has 2 half-hour periods, one at 10 and at 2, where she does her paperwork and her case management, and the rest of her day is filled with seeing clients, and she has to see about 7 to 9 clients a day. She has more clients if she has a group, and the clients are counted in that 1 hour period when she has her group. Her office is made up of a clinical psychiatrist who is the director, and then there are 3 other psychiatrists. There's 6 mental health specialists, 3 therapists, an office manager, and then 2 front desk workers. The clinic is part of a larger organization that includes doctors of all kinds, like pediatricians, general practitioners, specialists, and a hospital. Terry works at a couple different locations, and she has to use her car to travel to them. Some of the typical stressors that Terry says that come along with her job is that she doesn't have her own office. There's a general office general offices that they all share, and so she must bring her therapy tools with her each day and resources. That means she must prepare in advance, and she has to be sure she knows what her schedule is and who is on her schedule, and so she has to be sure she has tools for young kids if she's seeing them that day, or teens, or whoever she is meeting with. Another stressor is that she oftentimes has argumentative clients, because children and teens are the identified client. Sometimes they don't want to be there or engage in services, and so they can be angry and lash out at her as the therapist. Sometimes the parents don't want to engage in services and bring their children, and they're just coming because the doctor has said that they have to come, and so they might direct their anger at her. Another thing that she says is a stressor that she doesn't always have time for supervision, because her day is so packed, and so trying to get supervision with her clinical director isn't easy, and she has to be proactive and try to work that in between her schedule and the clinical director's schedule. Because she's a part of a larger organization, they have a shared electronic health record system, and one issue that's coming up is that the doctors think they should be able to see her notes because they are part of that same organization and that same health record system, and as a mental health provider, she keeps her notes shielded until there's a release in place, because some people don't want their doctors to see their records and know what's going on in therapy, and this is becoming a source of contention and a stressor for her between her and the doctors. Some of the benefits Terry has at her work is there's a retirement package, health and dental, death and dismemberment and disability. They get an educational package, which includes a week of paid training and $1,500 a year for any other training. The company pays for license renewal and anything else that they may need for licensure. She gets 5 weeks of vacation, but she must use her PTO for holidays and sick days. Samaritan is a large agency in the Corvallis area where she is, and this is a great benefit package. Some of Terry's common job tasks are: she does assessments and creates treatment plans, and she writes chart notes. She attends higher level of care meetings, which include RAP meetings to coordinate care for things like day treatment or residential care. She creates safety plans for children who have gone to emergency rooms and need a higher level of care but are not going to residential. She does CASIs, referrals for skills training, and occupational therapy. The bulk of her time is done doing group, individual, and family therapy. The educational requirements for becoming a licensed professional counselor are: you start out with a bachelor's degree, and then you have to get a master's degree. In Oregon, you then become a registered intern, and you have to accumulate 2,400 hours of direct client contact, and then 2 hours of supervision a month, and it must be completed within 5 years of graduation. After you've recorded your hours and supervision with the licensing board, you take the NCE license exam and a legal and ethics exam to receive your license. And once you're licensed, you have to acquire 40 CEUs every 2 years. 6 of those hours of CEUs have to be ethics training, and 4 have to be cultural competency. The starting salary range here in Oregon is $34,357 a month, and the experience salary range is around $70,480 a month. Some miscellaneous information is Terry had found out that from other providers that she's met from other states that Oregon pays statistically lower than other states, and that insurances pay more for LCSWs here in Oregon than LPCs, and in California, LMFTs get paid for more. So insurances pay differently depending on what kind of licensure you are. And currently in my area, in that the LPCs are in high need of demand. I just left an organization that we've been trying to hire an LPC for over 9 months, and there's just a lot of openings in our area and not enough people to fill them. And that is what it's like to be an LPC.